the reason for that is because of all those things that kidneys do. Okay, so what do we need to do? It's not that much, to be honest, because who's been for like an NHS check or like a blood test because of their diabetes or blood pressure? Yeah, so at that test you would always have your kidney function done. Whereas what is new, some of you might be in the last few years, GPs have been asking you to do a urine test as well. People done that? Yeah. So as part of a diabetes, have you done one?
Is that the one that where they check the protein?
Yes, it is. Yeah. So it's funny because you think about protein, you think about like chicken or whereas you can't see if you've got protein in your urine, and so we need to send a little urine off to the lab and see if there's any. It's essentially something that represents leaking from your kidneys. So if we can see that there's a bit of protein there. Slightly stressfully at moments it can be because you've got an infection actually, or because there's something else going on. It's nothing to do with your kidneys. But if we look at it together with your blood test, and that's why I brought this up, then we can understand: do you have CKD? What does that mean? How often do we need to monitor it? Is there anything you can be doing with your medications, with your lifestyle, to protect those organs that, as we've talked about, are so important? So. Occasionally for people with more specific problems going on with the kidneys, you might be asked to have an ultrasound or a function scan or see a kidney doctor, but typically, and when people hear chronic kidney disease, they think, oh, well, shouldn't I be seeing a specialist kidney doctor? Actually, normally we look after many patients who have chronic kidney disease in GP, and it is of course